So what's the long-term outcome after atrial fibrillation ablation? So we've been doing this. It was first described by a doctor named Dr. Hasseguer in Bordeaux, France in 1998. And since then we've been kind of modifying the technique, but it's essentially been built around isolating the pulmonary veins in one way or another. Probably the way we do it now has been going on since about 2004. And so we essentially have about 8 to 10 years of experience in isolating pulmonary veins. What kind of outcome data do we have? Well, we have a good 5-year follow-up. This is a multi-center follow-up trial. And essentially what they found with one procedure, they found at 5 years, you had a less than 40% rate of success it was about a 35% rate of success with one single ablation procedure. However, with more than one procedure, and it was an average about 2.1 procedures, I believe, you could have a fairly good chance of success. This is about 70% chance of success, which is reasonable at 5 years in all comers. I think if you limited this to paroxysmal patients, I think it would be a lot higher. If you said all these are going to be long-standing persistent, this would probably be a little bit lower. So I think it really depends on your patient selection, how good this 5-year follow-up is. But as you see, you do have drop-off. So what they say is that a lot of these patients, even after successful ablations, if they don't have good diabetic control, if you don't control their hypertension well, if they develop heart failure, valvular disease, if they have heart attacks, they're going to be at much higher risk for developing atrial fibrillation even after you successfully isolate their pulmonary veins and they were initially paroxysmal. So these patients, you still have to continue best medical therapy. You have to control all their comorbidities in order for them to have good long-term outcomes. That's very, very important.